Hi, I'm Dr. Cassi of Vetfolio and the host of this V2V video series sponsored by Boehringer Ingelheim Animal Health. Joining me today is Dr. Bryan Torres. He's an assistant professor of small animal orthopedic surgery and director of the Motion Analysis Laboratory at the University of Missouri College of Veterinary Medicine. Thank you so much, Dr. Torres, for taking the time to talk to me today.
Hey, Dr. Cassi. It's my pleasure, and thank you for having me. I'm real excited to be here to be able to sit down and talk about something that's near and dear to my heart, which is osteoarthritis.
Mine too. I'm so happy that we can sit down and talk about this. In this episode, we're taking a look at osteoarthritis pain and inflammation in dogs and some of the Boehringer Ingelheim animal health medications that can help veterinarians and pet owners alleviate OA pain and stiffness in their patients and pets. Medications like Metacam. So, Dr. Torres, we know that OA is one of the most common chronic conditions a dog can face, and yet it's often very difficult for pet owners to recognize the early signs. So, what are some of the signs that they're looking for?
Yeah, this is a really great question. It hits on really some important parts of successfully managing a condition like OA, right? It's this early identification and early treatment. So if we can recognize a problem like OA in the beginning stages, we are, as veterinarians, really given a huge opportunity to get a jump on treatment, a jump on management strategies, and hopefully alter the progression of the disease for the positive. In most cases, owners that have dogs with OA first start to notice changes in their movement or activity level. Some of the more common signs or changes that we see or that the owners will see are lameness, stiffness, difficulty rising, bunny hopping, and really in some cases, just an overall decrease in activity level. These can occur with varying degrees of severity in both early, mild, moderate, and even the more severe forms of OA. We as veterinarians notice some of these mobility changes in the exam room, but in many cases, it's the owners that report these changes to us. But we have to be cognizant that it's often easy for owners to identify these changes in the severely affected dogs. But the real challenge is in those dogs that are less severely affected and those that have more subtle changes, like we may see in those early stages of OA.
So in your experience, what are some of the ways that we can help pet owners be more proactive when they notice these signs?
Yeah, I think this is, this is something that we can really improve on and help in this area, right? So some owners are really hyper aware of any minor change that their pets may have in mobility or activity. And clearly this makes our job much easier to identify those patients that may have OA or clinical signs of OA. But this isn't always the case. This is why it's really important that we as veterinarians ask the right questions and educate our owners on what to look for in patients that may have osteoarthritis. So keeping that dialogue open is really, really important. And we should encourage our pet owners to come see us if and when they start to see those changes in mobility. So this should be a discussion that we're having frequently at their normal exams, right? Anytime that we can identify a problem like OA early, man, that's a win. We are giving that dog and the affected joint or joints a better chance at successful long-term management. And this is really what we want to focus on.
What are some of the factors that predispose a dog to develop OA?
Yeah, well, there are many factors that are linked to osteoarthritis in dogs, such as, for example, obesity, genetics, breed, activity level, and joint injuries, right? And because of that, we have a lot of opportunities to intervene early and to alter the course or the progression of this disease. And, one important factor that we see quite frequently is obesity. We see it both in humans and we see it in our dog population. We know that obesity increases the load placed on the joints and can increase the risk and prevalence of OA in dogs. And using weight management strategies to maintain our pets and our dogs at ideal weights throughout their lifetime is a really important step and part of any successful OA management plan.
Yes, and it can be hard sometimes to have that conversation repeatedly throughout the day. I know I find myself reminding myself, you need to have this conversation. It's helping our patients here. And that even though maybe I've had that conversation already 3 or 4 times, might be the first time this person is hearing it, how important it is. So thank you for reiterating it.
Absolutely. Absolutely. Yeah, it is really important. That is for sure.
So weight management, like we said, very important for dogs for many reasons. But going back to the genetic reasons, can you explain how genetics come into play?
Yeah, I mean, genetics and breed, can play a role for sure, and can predispose dogs to a condition that will lead to OA, right? Probably the most common condition that we think of is canine hip dysplasia. I mean, it's the one that really, if you're going to ask somebody, this is what they're going to think of. This is a heritable condition that leads to hip arthritis. And really, what we know is that early screening, early identification, particularly in those breeds that are more at risk, and especially when they're young, right? So this early part, right? That can really help owners seek treatment strategies and management strategies early. And in this way, we as veterinarians really are giving them the opportunity to have the biggest impact in the progression of this disease.
I'm thinking of my 1-year-old lab that's currently sitting in my office going, I should probably take some x-rays of him in the next year or so and see what's going on. So if a pet owner has their dog at a healthy weight and their pet is not a breed who would typically be predisposed to hip dysplasia, what do we tell those owners? I mean, are they in the clear?
Yeah, this is a really interesting question. They're absolutely not in the clear. But we as veterinarians need to always stay vigilant, right? Because consider something like trauma, or an injury to a joint, right? These are also factors that can predispose a joint to osteoarthritis. For example, we here in Missouri, we see quite a lot of working or sporting dogs, these agility dogs, right? These animals have chronic repetitive injuries, and it's not uncommon to find these animals have osteoarthritis in multiple joints, especially as they age. And so making sure that we're identifying factors like that may play a role in the development of osteoarthritis, especially as they age, is really critical.
Sure. And, we're talking about trauma and things like that. But for these agility dogs, this is just their normal daily activity that may be causing trauma to these joints. So I like what you said about staying vigilant.
Yeah, absolutely. Yeah, it's really, really important. You take things like, the rise in the pet population, dog owners, we are seeing more people get out and about, exercise their dogs, take them on runs, hikes, long hikes, right? So these animals, these dogs, they're getting a lot of activity. And so we have to stay aware that just because we don't have a heritable condition doesn't mean that we couldn't develop osteoarthritis down the road for some other reason.
Just like high-level human athletes, we see having to worry about their knees and their shoulders. It's a good reminder to make sure we're talking to the owners of sporting and working dogs. Are there other examples of dogs that you can think of where we should maybe be a little more vigilant?
Absolutely. We see quite a lot of other conditions that will lead to OA. And some other examples would be things like bone fractures, right, that involve the joints, like we see in young dogs. And we are seeing quite a lot of that nowadays. And we have a lot more puppies, in homes, or maybe one of the most common orthopedic conditions that we see and we have, which is cranial cruciate ligament injuries in dogs. We know that dogs are going to have OA to varying degrees in these joints. They typically come see us with already signs, radiographic signs of osteoarthritis in those joints. And so identifying these issues and risk factors early really gives us the opportunity to influence the course of the disease and to make a positive change, right? We're not able to turn back the time on OA, but we can make a big difference. And early intervention with effective management strategies and treatment strategies really gives us the best chance to make a positive impact on joint health. And that's what we want to do for our pets.
Early management.
Got it.
It can be hard to get owners on board when they're not always appreciating the signs. But yes, I have seen firsthand many times that early intervention and the benefits of that.
Absolutely. Absolutely.
So of course, NSAIDs are a key pharmacological intervention for osteoarthritis in dogs. How do NSAIDs like Metacam work with osteoarthritis?
Sure. Well, the These type of medications are non-steroidal anti-inflammatory drugs, or NSAIDs, right? So this is one of the most effective, frequently used, and well-studied class of drugs licensed for use in dogs with OA. They are so effective because they target both the pain and inflammation associated with OA by inhibiting some of these cyclooxygenase enzymes, cyclooxygenase 2, preferentially in many of these cases, which ultimately these are responsible for the production of a host of mediators of pain and inflammation within that osteoarthritic joint. And so they really are, like I said, they are one of the most effective and well-studied group of medications, and that's why they're so frequently used.
What sets NSAIDs apart from other therapies used for osteoarthritis pain?
Yeah, it's a great question. The one thing, or one of many things that may set them apart, right, is that NSAIDs, when we look at the information available to us as veterinarians on the effectiveness of a treatment in osteoarthritis in dogs with OA, the sheer amount of scientific research that's available to us on non-steroidal anti-inflammatory drugs is huge. And right, so it's this quantity of data that helps guide our clinical decision making that really sets them apart from some of the other therapies. We know from this information just how effective they are at reducing pain and inflammation in dogs with OA and improving their quality of life. And of course, they're convenient and they're cost effective. And it's because of these reasons that they're the backbone of most OA management plans. I mean, when you go out and look at how most veterinarians are treating OA in their dogs, they're including an NSAID because they work. Now, the particular NSAID you mentioned, Metacam, it's been in use in dogs for over 20 years. And one of the really unique things about it is that it's also available as a liquid formulation. This is different than most other veterinary NSAIDs on the market. So in this way, you have a product that is highly effective in dogs with osteoarthritis. It's in an oral formulation that allows it to be accurately dosed for dogs of all sizes, right? A liquid is easy to do that with, and it can be delivered in multiple ways. So this is a huge benefit to us as veterinarians.
I love it. So research, it's convenient, it works, and it can be dosed really accurately.
Absolutely.
All high points.
Yeah.
Can you give me an idea about how you use NSAIDs like Metacam in your daily practice?
Yeah, for me, NSAIDs like Metacam really, they play a key role in my treatment plans, as they really do in most veterinarians, right? They form the backbone of most of our treatment strategies. And overall, the way that I think about managing OA in dogs is by focusing on a few key categories or a few key areas. Weight management, exercise modification, dietary changes, which includes things like joint diets, joint supplements, or joint support products, drug therapy or pharmaceuticals, which includes things like NSAIDs, and then considering those surgical options when needed. And when we look at the treatment options that are available to us now, NSAIDs have been shown to be one of the most effective treatments that targets both pain and inflammation. And I've said this multiple times, but that's because it really is true. They're fantastic at that. And we know that they work. And the really great thing for us as veterinarians now is if you want to use an NSAID, we have a lot of options on how to deliver these medications effectively and how to tailor it to dogs of all sizes. And so this is a huge benefit to us because we see that osteoarthritis in dogs spans the gamut from a Chihuahua to a Great Dane, right? Spans all. It's going to be present, or it has the possibility of being present in really any dog that we see.
So let's talk about that, because dogs come in all shapes and sizes, and getting that perfect dose delivered can be a real challenge. So is there an alternative to breaking pills in half?
Absolutely. Now, you mentioned one particular NSAID that's very effective and is frequently used in dogs with OA, and that's Metacam. And as we just discussed, this particular NSAID provides veterinarians with two great options for delivering treatment. And this can be really, really important to us. Having options is a good thing, right? Its formulation as a liquid is unique to the veterinary NSAID market and allows us to accurately dose and treat dogs of all sizes. But many find it particularly beneficial when dosing smaller dogs or titrating down to the lowest effective dose. In addition, the injectable formulation that's also approved for canine OA gives veterinarians the option to start treatment in the clinic. It can be administered IV, so the owner will see immediate relief and results. And this helps demonstrate the clinical impact and really the importance of consistent and effective therapies, right? So with this strategy, injecting in the clinic also takes care of that loading dose. So the owner only needs to focus on maintenance doses moving forward. And so once again, having options like this is really important for us as veterinarians.
Yes, I know. In these little tiny ones, it's like Metacam to the rescue. And the idea of dosing it IV in the clinic and just kind of getting that ball rolling, I think is something that's super unique and super, super helpful.
It gives veterinarians options, right? This ability to do that. So in this case, they have the choice, right? They've got a liquid formulation, they have an injectable formulation. And so having these options for delivery of a highly effective treatment, therapy, NSAID, for the treatment of OA in dogs is huge. It's a huge thing for us. And so what we see is this gives us the ability to have the best impact, most positive impact on our patients with OA, regardless of the size, right? Regardless of whether it's a Chihuahua, a Corgi, a Labrador, a German Shepherd, or a Borzoi or Great Dane. So there you go. Doesn't matter. Spans the gamut.
So giving a pet owner an OA diagnosis can be overwhelming for some, especially when they're told this is a lifelong condition that we're not going to cure, we're going to manage. How do you start the discussion with owners about OA management?
Yeah, I think, this is really a great question, right? This can seem challenging, but it doesn't have to. I think ultimately it comes down to having a thoughtful conversation about what the problem is and letting the owners know that you've got a plan to start addressing the issue. One strategy for me that I have found really, really effective is trying to make a problem like this relatable. Owners that have OA or have a family member or friends with OA or other joint conditions are often very aware of the chronic and everyday nature of this condition. So this helps them put their pet's condition and need for consistent treatment, consistent therapy into a much more relatable, context. But more importantly, what I have found is that they're often well aware of how effective these treatment strategies like NSAIDs are at reducing pain and inflammation that's associated with this disease. And so for me, making it relatable has always made it easier to have this discussion. But I think one of the added benefits that we see with this is it also improves treatment compliance. They understand the everyday nature. They understand that there are going to be ebbs and flows in the severity we might see in OA, but it's an everyday problem. And so consistent therapy, consistent effective therapy is really critical.
And treatment compliance, that's the big point, isn't it? What are some of the challenges you've seen when working with owners to get a handle on their pet's OA?
Yeah, one of the biggest challenges that I face, and I'm sure many other veterinarians face it on a daily basis, is that when medications like NSAIDs are so effective, some owners just stop giving the medication when the lameness or when the pain resolves, and then they'll just restart it when needed, right? But once again, going back to this, being able to really relate to a condition, when owners can relate to what their dog has, like osteoarthritis, they often have a better understanding of its everyday nature and the need for consistent treatment. They also know firsthand the power that an effective treatment like an NSAID can have on your quality of life. So having a discussion about not only the disease and treatment strategies, but also the need for consistent and effective therapy is really important. And during these discussions, we can help our pet owners choose strategies that have the best chance for a positive impact on OA. We can help them choose those strategies that are most effective and use their resources wisely, and then ultimately are achievable for them, their pets, and their lifestyles. So the goal that really as veterinarians that we should all have with a condition like OA is to, one, identify the problem as early as possible, two, educate our owners about the condition, and three, implement effective and consistent treatment strategies or treatment plans. If we do this, we're going to win every time.
I love that. Set everybody up for success.
Absolutely. Yeah.
What are some of the considerations that should be taken into account when we're coming up with a treatment plan?
Yeah, once again, another great question. One of the unique things about OA is that it spans the gamut in dogs, from young dogs to old dogs, from healthy dogs to dogs with various illnesses and other concurrent conditions, right? And this can make treating our pets with OA complex sometimes. But if we as veterinarians go into an OA management plan with just tunnel vision and think that every case is going to be the same, we're probably going to miss some key opportunities to improve comfort, compliance, and quality of life. And so I think for us, it's really important to keep this in mind, that each case is different, that each case may benefit or may see improvements with different strategies, right? And for us to be able and willing to tailor our treatment plans to fit the patient and the dog owner, right? And so part of this means that these exams that we're doing yearly, when we're seeing these pets, when we're evaluating them, we have to be willing to adapt our therapy to make changes if needed. And this is really one of the most important parts of any OA management plan that I see is once again, don't have that tunnel vision. Know that we may need to adjust. Every dog's an individual, but we have a lot of effective treatment strategies like NSAIDs that can benefit all of these patients.
And that brings up a really good point. This could really be a long-term process. How do you set it up to monitor their progress and their response to treatment over time?
Yeah, these are challenging things, but they don't have to be. Our patients are living longer lives, which means that our role as veterinarians in treating and managing chronic conditions like OA is becoming more and more important. And like we talked about before, the pet population is booming. And so this is going to be more critical for us in the coming years as we are seeing more and more pets out there in families and with conditions like this. And so as with any chronic disease like OA, one of the most important things is to schedule pets at regular rechecks to monitor their health, general health, and everything else, including OA, and their response to your treatment plan. These rechecks these should include good discussions about, how the pet's doing, how is the dog doing on whatever treatment strategy we have going. Thorough physical exam, blood work, any biochemical tests, maybe radiographs if needed. These are really, really important. And each one of these times that we see them, it gives us the opportunity to see how we're doing clinically. It gives us the opportunity to adjust the treatment strategies that we're using. And when we think about our aging pet population, the older dogs that may have other comorbidities or may have developed other comorbidities between examination time points, these animals, there's even a greater need for rechecks to ensure that we are on the right track with the strategy that we're using.
One of the key takeaways for me is that we really have some great treatment options for managing OA in dogs, and that NSAIDs play a key role. But I was also excited to learn that some of these medications are available in different forms, like liquids, injectables, IV injectables. That's really exciting. And this gives veterinarians and owners a lot of options to successfully treat OA in dogs of all sizes. It certainly makes it much easier to tell pet owners, hey, let's help your dog find relief and get them back to doing the things that they love.
Absolutely. I think you've nailed it. That is perfect. You've nailed it, right? We as veterinarians, this is a great time to be a vet. We have a lot of options, especially when we're talking about OA, right? We've got a lot of options available to us to reduce the pain and inflammation associated with this disease and ultimately improve our patients' quality of life. And that's wonderful for us.
I agree. It's so rewarding to see these guys come back and they're feeling so much better and they're moving around and mom and dad are happy. Everybody's winning.
Absolutely. Yeah. It's amazing to see that, isn't it?
It is. It is. So thank you so much for joining me, Dr. Torres. We really appreciate your time and giving us all this information. to make sure that we have the ability to help our patients.
Yeah, thank you very much for having me.
And thank you to Boehringer Ingelheim Animal Health for sponsoring this series on managing pain and inflammation in dogs. I hope you'll join us for the next Vet2Vet for more in-depth conversations. And remember, if one animal is better off because of you today, it's a great day. Here's some important safety information for Metacam. Metacam, meloxicam oral suspension, is for use in dogs only. Metacam solution for injection is approved for use in dogs or cats, not indicated for osteoarthritis in cats. Repeated use of meloxicam in cats has been associated with acute renal failure and death. Do not administer additional injectable or oral meloxicam to cats. The safe use of Metacam in dogs younger than 6 months of age, dogs used for breeding, or in pregnant or lactating dogs has not been evaluated. As a class, cyclooxygenase inhibitory NSAIDs like Metacam may be associated with gastrointestinal, kidney, or liver side effects. Dogs should be evaluated for pre-existing conditions and currently prescribed medications prior to treatment with Metacam, then monitored regularly while on therapy. Concurrent use with another NSAID, corticosteroid, or nephrotoxic medication should be avoided or monitored closely. Owners should be advised to stop the medication and contact their veterinarian if side effects occur. For more information, please see full prescribing information.